In 2012, I won the Kudos Medical Scientist Award for work that I'd done in atrial fibrillation. A lot of that work was what I'd built on from my PhD, and we've continued some of that work here by bringing novel technology and applying it to the Waikato hospital population. And in 2015, I was co-chair of a document that was best practice for programming defibrillators. And what was nice about that is, having written these guidelines, is you have the idea that you can be helping patients in Johannesburg or Hong Kong or New York who you've never met before because somebody has taken your work and applied it to a patient. And one of the privileges I had was to put the first subcutaneous defibrillator in Asia, because New Zealand had been really at the forefront of that work. And I was able to proctor some 6 cases, I think, through 3 hospitals in Hong Kong and disseminate some of the knowledge that we'd gained from our local work. And in 2020, I led an international document which was about investigating patients who'd had unexplained cardiac arrest. And we see this in the hospital. We have people who are otherwise well and they have cardiac arrest, and many of those may have a heritable condition. So what we hope to do is, either by clinical testing or now by genetic testing, figure out why those people have had a cardiac arrest. And if we find that out, we can help them, prevent them from having another cardiac arrest. Not only that, we can help their family members from having the same fate. So we were able to put this document out there as international best practice, and again, my hope is these patients who are previously going undiagnosed will now become diagnosed, not just in Hamilton, not even in New Zealand, but around the world. So one of the nice things about receiving this award in 2012 is that I'm from Hamilton. So it's nice to be honoured by the Kudos Awards that are based in Waikato for someone who went to Hillcrest Normal, went to Barclay Intermediate, went to Hillcrest High, even went to Waikato University for a year. So it's really nice for me to have that community connection. And even stronger than that is that actually you run into the patients. I can distinctly remember going past the wife of one of my patients, and their children said, "Who's that man?" because I'd been talking to her, and she said, "That's the man who fixed Daddy's heart." Since 2010, I've gone from a junior researcher to getting a bit more of a global look on things, and realizing that the one-on-one patient thing was great, but I could help more people by maybe doing research, by disseminating it, making guidelines. But then you have interactions like you have in the supermarket, and it brings you right back to the patients, and that's what we're here for.